Hi, my name is Jennifer Turner, and this is my video 2 for Vet 122 Spring 2013. This video talks about the preparation, position, and measurements for a cat for an upper GI barium study. So there's a couple things you need to do for preparation of the patient. The patient should be fasted 12 to 24 hours before the procedure, per the orders of the attending veterinarian. And oftentimes they'll have you even hold water for the 2 hours before the actual study. Enemas might be necessary just to get that GI tract nice and cleaned out before the study. Okay? Sedation is not a desirable thing because it does slow down the GI tract, have effects on the GI tract, but you can sedate a feline patient with a combination of ketamine and diazepam using the doses given by the veterinarian. Okay? You also need to calculate your barium suspension and make it up according to the directions. Generally, it's between 12 and 20 milliliters per kilogram, so you need to know the accurate weight of your patient, and you'll need to know the dosing that your doctor requires. Then after that, you need a feeding tube, depending on how the veterinarian would like it administered and how far down into the system. You would measure this on the patient and cut it if necessary. You could lubricate the tube, use a mouth gag. A lot of times they use a roll of tape. You probably have to trim this down and make it smaller to fit in his mouth. And then you place the tube. You put in your solution that you made up according to the doctor's request for dosing. Then you would put in a little air or a little water to flush the system to make sure that you get it all out of this tube. Just enough to make sure the full dose is out of the tube. Okay? But before you mix this up, you need to pre-measure the patient for the radiographs and set the machine. Okay? So we'll do that next. Okay, we're back and we're in the x-ray room. And we've got our patient here, Katut, and he is not sedated. So before we give our barium solution, before we make up the solution and give it to him, we need to have the x-ray machine set. Because after administration, you need to immediately take the first set of x-rays. We're interested in both lateral views, and we're interested in a BD and DV view. So we need to take those measurements, set up our machine. I have my gloves here, and I have my badge here, and I have my protective equipment. Okay. So, I'm going to measure him. We'll take the measurements in centimeters. And here he is 9. Hang on, buddy. Stay with me. Here's 14. You could lay him down, and if we had 2 people, we could lay him down like this. Take a more accurate measurement. 14 and 9. Okay. So then now we have our measurements. We know it's 9 centimeters for the one direction, and we know it's 14 for the other. So we would get our technique chart here, and we would follow what it says. We would make sure. So for the chest type views, we would need the 5 MAS, and then for the lateral, we would need 82 kVp, and for the VD and DV, we would need 96. Okay? So then you would go ahead and pre-program at least one of those and have the other number set aside here and written down so you know what it is. You can quickly change. Okay? And you gotta have your gloves. So what you want to do is administer the barium, immediately take the first set, then take another one in 15 minutes, another one in 30, another one in 60, and then as many as you need after that until the barium is clear to the area that the doctor is interested in viewing. Okay? So that's how we would take our barium series. Thank you. Thank you, Mr. Katuti.